When you compare the space we have created together with traditional hospital spaces, experiences, how would you compare?
Well, we experienced 15 years of hospital spaces in China also, right? So, and you can imagine that was, well, they are very cold, very focused on getting things done.
Functional.
Not comfortable. Yeah, exactly. Functional, quick.
Functional, fast.
Yeah, fast. And I'm not sure. I didn't go into the history of newer hospital space, but I guess the change in hospital space was triggered by children, by designing more comfortable space for the little ones. And I think that's where different materials came in, colors came in, different room setups. They don't look like a hospital necessarily anymore. And I think you can say, like, with a balance, right, is a practice. This is on the same track, I would say, right? Like you design a children practice for children, for instance, or similar.
Yeah, practice for children, because we realize maybe very, very early that children need also comforting.
Exactly.
You automatically care about children from a mental health perspective a little bit more. Whereas with adults, we assume, they are fine. They are just here for a surgery, just here for the functional work to do.
Yeah, children, they are not used to hide their emotions, right? So that's something we adults, we learned through our life.
Emotional regulation.
To control ourselves, and but children are not like that. So if they feel frightened, they feel frightened. So you need to create an environment to make sure they can open up. And as a doctor, you can have access to this child and maybe talk with the child and work together to create a healing. And I think for adults, this was not the case, but meanwhile, I would say studies also show that if medical spaces look different and have this kind of higher level of comfort, that the healing process is also enhanced, basically. Yeah.